we did decide that we wanted to have a family, we knew that we'd have to be creative somehow. And we were really confident that we wanted to have Leah donate the eggs and then use my sperm for a couple reasons. It was special that our child then gets to have a genetic connection with both of us, both the Eledge side and the Doherty side.
They never even mentioned of having a family. They always said that they wanted to be the fun uncles. So when they did approach us and said, you know, we're thinking of starting a family, well, from my standpoint, I was just ecstatic that, oh my gosh, we get to have another grandchild. And then at that time, that's when I just said, you know, if you're looking for some candidates for this, I love being pregnant. I don't see any reason I couldn't do it. I said, but I'm just saying, if you're taking names, put my name in the hat.
We didn't know that someone that was postmenopausal, that was at the age that she was at, could carry a child.
At the time, the boys were like, there's no way, you've already been through menopause, you're old. The minute we walked into the place, it was just, I had this feeling come over me like, this is where we were meant to be. This is where this is all supposed to happen.
We walked in and we felt cared for, we felt loved, but we also felt like everybody else.
Yeah, we didn't feel like we were like a spectacle of some sort. We just felt like a normal family that was in there for our appointment, which was really comforting for us.
We were surprised that, you know, we had this patient, but then we were going to take care of her like we do with any other patient.
And you could tell from the very beginning that they weren't so interested in so much as the story, but as me as a patient and Uma as a patient, and that was their main concern.
We were concerned about the growth restriction with the fetus, so we have to make sure we're keeping an eye on the baby's growth throughout the whole pregnancy. So what we were doing, we had to get an ultrasound every 4 weeks to make sure baby was growing well. We started doing non-stress tests at 32 weeks just to make sure baby's doing well.
He had such a connection with my mom. He made her feel so secure and safe, and it just felt right. It was like, okay, it's time for a birthday party, and he's gonna be there, the one to greet her for it.
And I was just grateful. I kept saying, oh my gosh, I said, I'm so glad I had her before your shift ended, because I was so afraid that I was gonna go past your shift. And the nurses had said, he already told us, no matter what time she has this baby, I'm gonna be here for the delivery. And I just thought, that's a commitment, because, you know, he could clock out at whenever he was supposed to, but he was there to see me through this whole ordeal. And that to me spoke volumes. I'm thinking that's a dedicated doctor.
With the professionals that were around us, the nurses and then the lactation consultant, I guess I thought they were going to be there to make sure that Cele was okay, and then they were just going to hand us a baby, but we felt like they were just like educating us, and I walked out of there feeling so confident, knowing how to take care of Uma and how to feed her and how to meet her needs.
They were enthusiastic and excited about this unique situation, but that never really was the forefront. They were just excited about a baby being here, and they were excited about taking care of us.
The privilege is ours that they let us take care of them and be part of their family.
I think that this could maybe give some hope to LGBTQ couples, but also straight couples that maybe are struggling with fertility issues, that there are other options. And if you have a community of people around you, there are some resources that you could reach out to. And while it's not the conventional path, it still is a really beautiful path.
But the minute I saw those two boys with that baby, I remember thinking it was just like a relief off me, going, wow, I'm done. It's their time for their journey and their book story to tell. And I knew they were going to be just fine. I knew then at that time everybody is going to be one happy family.